Did you know that a new antidepressant might be a secret weapon against cancer? This discovery could revolutionize cancer treatment, but it also raises some serious questions. Scientists in China have found that ancer hydrochloride, a new kind of antidepressant, could potentially restore the body's ability to fight some types of cancer. When combined with anti-tumor drugs, it appears to inhibit colon cancer cell growth, strengthen the immune system, and induce a form of programmed cell death. Interestingly, this drug doesn't just inhibit the Rh uptake of serotonin, like many antidepressants, but also slows the Rh uptake of norepinephrine and dopamine. However, it's important to note that this research is still in its early stages. While the drug has passed phase 3 clinical trials as an antidepressant and is approved for the treatment of major depressive disorder in China, its role in cancer immunotherapy is mostly unknown. Moreover, the use of antidepressants can potentially cause cancer, according to some studies. What do you think about this? Could the potential benefits of using antidepressants in cancer treatment outweigh the risks, considering that some studies suggest they might actually cause cancer? The most controversial comment will be pinned at the top. Subscribe to the channel and activate the bell for daily health news.